Good morning! Happy Saturday sa lahat! So, dahil Saturday ngayon, try kong madami akong mababasa. Hopefully, walang interruption masyado kasi walang masyadong tao pag Saturday dito. So, let's begin. Vaginal douches. Using a post-coital douche to flush out the semen is not recommended as a form of pregnancy prevention. Sperm swim very fast and can be found on the cervix of the uterus within 90 seconds of ejaculation. So even proprietary hygiene products with a spermicidal additive are not safe, let alone plain or salt water, vinegar, or lemon juice. I once came across a woman who had tried her own version using antiseptic cream, which had given her severe vaginitis. Severe. Barrier methods: condom or shat. Shit. Siat. Shit. Condom or Ziat. Ziat. Used properly, condoms are an effective and inexpensive form of contraceptive and also provide protection against the spread of sexually transmitted infections. Many are impregnated with spermicide, and spermicidal cream or jelly increases their safety and reduces the risk of fertilization in the unlikely event that the condom should split. A condom may become damaged if not removed carefully from its packaging by incorrect application or if the latex rubber has lost strength because it has exceeded its shelf life. Men sometimes complain about a dull sense of feeling or loss of spontaneity, although the latter can be overcome by incorporating the putting on of the condom into foreplay. Female condoms are more expensive and bulkier than male condoms, but are also very reliable and give the woman control over contraception. Diaphragm or cup. Another barrier methods. Like a condom, dia, or ito vagina, severe, dia, or cup. Like a condom, a cervical diaphragm or cup diaphragm or cup provides barrier that interrupts the sperm's passage towards the egg, but is reusable rather than a one-time throwaway item. A diaphragm is a flexible rubber dome that fits inside the vagina right across the width and is held in place by a spring. The cup is smaller and more rigid and is shaped to fit over the cervix at the entrance to the uterus. Both are used with a spermicidal jelly and can be inserted several hours before intercourse. They must be left in place for several hours afterwards. Size is important. Too tight can cause irritation due to friction. Too loose in its effectiveness will be compromised. Your diaphragm should be fitted by a trained healthcare professional who will show you how to insert and remove it and instruct you in its use and care. Scrupulous hygiene is also important. Correctly inserted and not removed prematurely, diaphragms have a good safety record. Failures usually come from incorrect size or fitting. Rubber does perish, so you should replace your diaphragm about once a year, when you should also be checked to ensure that the fit is still correct. Any internal changes may mean a different size is required. Diaphragms have the advantage over condoms of being in the woman's control, and as long as she has taken the precaution of inserting it beforehand, not interrupting lovemaking in the early stages, some women get the hang of inserting them more easily than others. IUD or intrauterine device. This small device, also called the IUCD, intrauterine contraceptive device, loop or coil, is made of plastic or metal or both. It is introduced into the uterus through the cervical canal and can remain in place for a year or longer. Despite different models of IUD having been available for many years, it is still not completely understood how they work. Being a foreign body in the uterus, the IUD affects the quality of the endometrium, the uterus lining, and may also make it physically more difficult for an egg to implant successfully. Copper in an IUD also affects the endometrium as the metal gradually ionizes. The most common side effect of an IUD is to make periods heavier and more prolonged. So if your periods are already heavy, this may not be the best option. After perhaps a little initial discomfort of fitting done by a qualified person, you should not otherwise be aware of the device. For some women, however, it can be the cause of continued cramp and discomfort, spotting, or bleeding or vaginal discharge that may indicate pelvic infection. If this happens, your doctor or family planning advisor will usually want to remove the IUD. A variation on the standard IUD is a coil that contains a synthetic hormone, progestin, which is slowly releases. This causes period to stop and can provide contraceptions for up to 5 years. If it doesn't suit you, side effects from the progestin may include acne, depression, headaches, or hormonal weight gain. It is occasionally possible for a fertilized egg to develop despite the presence of an IUD. If this happens, the IUD needs to remove. Saan na ba tayo? It is occasionally possible for the fertilized egg to develop despite the presence of an IUD. If this happens, the IUD needs to be removed as quickly as possible. But its removal may trigger a spontaneous abortion. There is also a slightly increased risk of ectopic pregnancy, example outside of the uterus. It is possible for an IUD to be spontaneously expelled, most likely during menstruation. So it is necessary to check that the device is in place. A small cord that extends down into the vagina enables you to do this. Hormonal contraception, the pill. The active ingredients in the contraceptive pills are synthetic steroids, similar to the natural female sex hormones, and thus is designed to inhibit ovulation. The combination pill containing estrogen and progesterone is typically taken daily for 21 days, followed by a 7-day break to make up a 28-day cycle. To avoid losing count, packets often contain 28 pills to be taken in order. The final 7 pills are in effect placebos as they don't contain any hormones. Most complications of the contraceptive pill are due to estrogen, which lead to the development of lower dose pills. Early forms of the pill contain 5 times or more estrogen than most current formulas. The mini pill or progestogen only pill avoids estrogen altogether. Without estrogen, the mini pill does not stop ovulation, but triggers the production of thick mucus discharge at the opening of the cervix, which bars sperm from entering the uterus. Should any get through, the progesterone also acts on the endometrium to prevent an egg from implanting itself. Without ovulation, there is no real menstruation, but the 7-day break triggers withdrawal bleeding, which is much the same in practical terms. Although often rather lighter, it is possible your periods may stop altogether. Some women welcome this, but others prepare the additional reassurance that they are not pregnant. The pills need to be taken regularly and in the right order. With some systems, there may be 2 or 3 different formulas within a month's supply. Missing even one or two can negate the contraceptive effect. The lower the dose, the more precision is necessary, and very low dose combination pills and many pills should be taken at the same time every day. The contraceptive pill, provided it is taken correctly, is reassuringly effective, but not without certain rest. Side effects. Reaction vary both from individual to individual and from pill to pill. Some women may complain of cyclical headaches or breast tenderness, while others find exactly the same symptoms clear up when they are on the pill. Fluid retention, weight gain, and a slight increase in blood pressure are all common effects that are necessarily a problem but should be monitored. When taken over a long period, 5 years or more, the pill can sometimes have greater side effects. A regular supplement of hormones disturbs your hormonal system. When you stop taking the contraceptive pill, it may take time for your body to reestablish its natural balance and cycle. Fertility may not return for a year or so. There is more work to be done on the difficulty of conceiving after prolonged use of the pill. The synthetic hormones are metabolized, deactivated, or destroyed by the liver, and taking the pill long term can impair the liver function. Saman? King, bayad ko sa imong nanay. Akong karoon. Sa imong nanay. Thank you, te. It's not until you fall. Saan ba tayo? The synthetic hormones are metabolized, deactivated, or destroyed by the liver, and taking the pill long term can impair the liver function. One of the side effects of this is to affect the liver's ability to control blood clotting, which leads to danger from stroke, pulmonary embolism, and deep vein thrombosis. Danger from stroke, pulmonary embolism, embolism, pulmonary embolism, and deep vein trauma. So man, ay, good morning ate. Ah, 50 te? Thank you. Salamat. Deep vein thrombosis. I have always cautioned young girls about the use of contraceptive pills. Teenage pregnancy is on the rise and have become a major social problem. But if you tamper with tamper with nature, then your body is more likely to go wrong. I have known 5 young women who have suffered a stroke while on a pill. Another function of the liver is to produce enough bile for the digestive system. Bile is a natural suppressant of yeast and candida growth in the gut. Contraceptive pills are often linked to candida overgrowth, resulting not only in digestive problems but fungal outbreaks in other areas such as thrush and athlete foots. Mm, Thrush. Increasing the estrogen in the body over time may also increase the risk of breast cancer. The mini pill slightly increases the risk of ectopic pregnancy. So, ang daming side effects ng mga pag ng contraceptive pills. Pill problems. If you vomit within a few hours of taking the pill or have severe diarrhea, you may not be protected. In that case, continue taking the pill but use additional protection such as a condom for the next 7 days. Some medications, such as antibiotics and complementary medicines, can make the pill less effective. If you are unsure, ask the advice of a doctor or nurse and use additional protection such as condoms. If you forget to take a contraceptive pill, the steps you should take will mainly depend on the type of pill you are using. Combined pill, less than 12 hours late taking the pill, take the last pill you miss and continue the rest of the pills as normal. If there are less than 7 pills left after the missed pill, continue with the pack and go on to the next pack the following day. Don't leave the usual 7-day break. More than 12 hours late taking the pill. Take the last pill you miss and use a condom for the next 7 days. Do not leave the usual 7-day break. Every day combined pill. More than 12 hours late taking the pill. Yun yung para sa combine. Ito namang isa is para sa everyday combined pill. More than 12 hours late taking the pill, take the last pill you miss and use a condom for the next 7 days. If there are less than 7 active pills left in the pack, take those as a normal and then continued with the next active pill, missing out on the larger inactive pills. Progesterone, progestogen, progestogen only pill. Less than 3 hours late taking the pill, take it as soon as you remember in the next one at the usual time. More than 3 hours late taking the pill, take it as soon as you remember, and the next one at the usual time, even if this means taking two at once. If you have forgotten more than one pill, take the last one you missed and the next one at the usual time and use a condom for the next 2 days. And in addition to contraception, the right type of pill for you can have positive side effects and may prove beneficial to problems such as menstrual cramp, PMS, breast tenderness, very heavy periods, unpredictable periods, anemia from irregular or excessive bleeding, polycystic ovaries, hirsutism, acne, abdominal pains associated with endometriosis. Morning after pill. Postcoital emergency contraception. The most common form of treatment involves giving high dose tablets of an estrogen derivative within 72 hours of intercourse. If taken on time, the effectiveness is about 75%. The most common side effects are nausea and sickness, headaches, fatigue, and general feeling of being unwell for a few days. The progesterone-only postcoital pill is better tolerated. The sudden surge of hormones in the blood confuses the body, and the endometrium becomes non-receptive to a fertilized egg. These hormones give a false message to the pituitary, which temporarily stops producing luteinizing hormone. Luteinizing hormone. Hormonal contraception by injection or implantation. An increasingly popular alternative to taking hormones orally every day is to have a periodic injection or implant. Depending on the strength and combination of hormones used, this can become protection for us up to a year. The hormones interfere with the pituitary's mid-cycle production of luteinizing hormone and ovulation is suppressed. The imbalance caused by this suppression means the endometrium may not develop so well, resulting in menstruation that is either irregular or suppressed. Menstruation may continue to be absent for a year or so after this form of contraception ceases. Other possible side effects may include headache, fatigue, dizziness, nervousness, and abdominal discomfort from pain or bloating. The low estrogen levels in the blood may reduce bone density. Sterilization. Stilling or severing the fallopian tubes cuts off the egg. Hmm? Pila. Pila. 7. Ay, tite. Ah. Wala ta size thing. Wala. So na said, sterilization, stilling, no, sealing, rather. Sealing or severing the fallopian tubes cuts off the egg's route to the uterus. Although in theory the operation can be reversed, the success rate is not good and this should be considered a permanent form of contraception. Sterilization. For this reason, you will be asked many questions about your circumstances and reason for wanting sterilization, and you should carefully consider all the pros and cons before proceeding. The operation is usually done under general anesthetic using keyhole surgery, so recovery is quicker than it would be with open surgery. Although although you will still need to take things easy for a week or two. If you are in steady relationship, the question of which of you should be operated upon will arise. A vasectomy for a man is less involved operation, but this needs to be weighed against your own particular feelings and requirements, and also what may happen in the future. Sexually transmitted infections, or STI, as recently as 20 years ago. STIs were usually lumped together under the umbrella VD, or venereal disease. VD. Ah, duha. Nya isa ka. Vital though it is to curb the spread of HIV and AIDS, it is the more common infection that are worrying, precisely because they are also widespread. It is estimated that up to 1 in 20 women under the age of 30 have chlamydia. 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 And up to 30% have had it in the past. Women are more vulnerable to STIs than men. They don't get infected more frequently, but they are more likely to be asymptomatic. Where a man may be warm, where a man may be warned, saman. You. Sige, lamat. Women are more vulnerable to STIs than men. They don't get infected more frequently, but they are more likely to be asymptomatic. Where a man may be warned by a sore or lesion on his penis, a woman may be quite unaware of a similar sore in her cervix and so not seek treatment at an early stage. Also, when untreated infection spreads internally, it can cause damage to the reproductive system, leading to sterility. Despite the blanket label, not all STIs are only transmitted by sexual contact. Personal hygiene plays a part in the transmission of some infections, and some can be passed from mother to child, either while still in the womb or during birth. HIV and pregnancy. If an HIV positive woman becomes pregnant, she stands a better than even chance of passing the virus on to her baby before it is born. A decision to have an abortion is never easy, even in such circumstances. So it is important to get impartial expert advice on the best way to proceed and to discuss things with your partner. If you come to the conclusion that abortion is not an option, seek out sympathetic support. You will be offered antiviral drugs such as AZT, which reduce the risk of your baby acquiring the virus. AZT. Helping yourselves and others. Most STIs can be effectively and simply treated. The problem is realizing there is a problem if there are no early symptoms. This leads to the single biggest concern, the ease with which STIs can be passed on and proliferate. The more widespread an infection or disease is, the greater the likelihood of catching it. So, in the realm of public health, the aim of doctors, genitourinary clinics, and so on is not just early diagnosis and effective treatments of individual patients, but curtailing the spread until reliable vaccines are found that work in all cases. The best methods are education and protection. On a personal level, this means being informed of the different types of STI. Statistically, your chances of becoming HIV positive are very low, but the chances of being infected by genital warts or chlamydia are very high. In both of these can be threaten your overall health if not treated. Not exposing yourself to unprotected sex with a partner of whom you are not sure, going for a checkup if you have any concern, even if you have no symptoms, following any treatment fully, being honest and open about sexual contacts when asked. Clinical staff have heard it all before, so don't allow embarrassment to stand in the way of efforts to limit infection in others. Chlamydia. Chlamydia infections are on the rise, and infection chlamydia trachomatis is the most common form of STI. Media trachomatis is the most common form of STI in girls and women because chlamydia is widespread. The chance of recurrence from contact with different sexual partners is also a constant worry, leading to suspension and tension in a relationship. A smelly vaginal discharge with inflammation of the cervix may warn the infection, but more often there are no symptoms. Undetected chlamydia can lead to tubal blockage and pelvic inflammatory disease with subsequent infertility. It can also cause complication in pregnancy, increase the likelihood of ectopic pregnancy, bring on premature labor, and spread infection in the fallopian tubes after delivery. The infection can be passed on from a mother to her newborn baby. Although not a life-threatening disease, chlamydia can have disproportionate consequences many years after infection. To discover at 30 that you cannot have children because of the infection you never knew you had a decade or more earlier can be devastating. Diagnosis is by a simple laboratory test. It may be discovered a result of a precautionary checkup or in a routine gynecological examination. Sexually active women under 20 years of age are 2 to 3 times more likely to have chlamydia than others. So, screening sexually active teenagers is a sensible measure. Treatment is a straightforward course of antibiotics. All women treated for chlamydia should subsequently be screened every 3 to 4 months. Herpes simplex. Herpes simplex. The virus herpes virus hominis is the most common cause of the genital ulcers or herpes. It is referred to as HSV2 to differentiate it from HSV1, herpes or cold sores around the mouth or nostrils. But the two cross infect. So someone with a cold sore on their lip, for example, could infect you with a genital herpes in the course of oral sex. After an incubation period or 2 to 7 days, small blisters appear on the labia and inside the vagina, often heralded by tingling, burning, and itching. When this eruption bursts, they form small, painful ulcers. They may be a watery discharge. Urination may be frequent or difficult, and often people feel tired and feverish. Sexual intercourse is painful, but you should abstain anyway because the infection period lasts for as long as there are visible signs and for up to a week afterwards. These ulcers may persist for 2 to 6 weeks and then heal without scars. The ulcer heal on their own, indicating the body had developed some sort of immunity. Recurrent attacks can be expected, but with fewer smaller ulcers that heal more quickly. The virus travels not in the blood, but through the nervous system, which accounts for the burning or tingling sensation in affected nerve endings. Although you are not infectious between attacks, the virus does not disappear but goes dormant, retreating to the ganglion of nerves near the spine. Since the ulcer heals themselves, treatment is mostly a matter of relieving the symptoms. Loose fitting cotton underwear, careful genital hygiene, and cold compress all help minimize aggravation, and painkillers are helpful. I often recommend NEM. It is Mar, Margosa oil. Neem or Margosa oil, which has some antiviral properties, or marigold oil or cream verocas, as used for verocas, which may give quicker relief. Women who suffer from regular recurrences, perhaps as often as once a month, are often healed by a prescription of aciclovir. Aciclovir. An antiviral drug. It is often said that frequent intercourse may cause recurrent herpes, but flare ups are more likely when you are run down or stressed. Following the lifestyle program has for many women reduced the frequency of their attacks. Genital warts. These warts may appear on the labia, within the vaginal or on the cervix, and through small cluster together to resemble miniature cauliflowers. They are caused by papillomaviruses. Papilloma viruses. In are related to warts you might get on your fingers and elsewhere. However, unlike herpes, you cannot catch genital warts from other forms of warts. Genital warts are contagious and you should refrain from sexual intercourse until treatment has been completed. During pregnancy, they tend to grow rapidly and should be treated before delivery, as they can be passed from mother to baby during birth. They may also sometimes be an indicator of precancerous cells on the cervix, so a diagnosis will usually be followed up by a checkup in biopsy. Standard treatment is to paint the warts with dienchloroacetic acid. Denlo, denloroacetic, denloroacetic acid. Once a week until they disappear. This can take several weeks. They can also be treated with lasers or cryosurgery. Cry? Cryosurgery. Cryosurgery. Using liquid nitrogen to freeze the warts. Herbal remedies such as tuja, tuja, marigold product in neem, margosa oil can be helpful. Gonorrhea. Ang dami palang ano, sakit. Gonorrhea. 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 Royen. Roya. Gonorrhea. Gonorrhea. The bacterium Neisseria. Neisseria. Gono. Ne. Gono. Gonorrhea. Thrives mainly in the urethra but can be found in the cervix, anal canal, and throat. There is a short incubation period of 3 to 5 days. The infection is initially asymptomatic, but later symptoms include a thick, grayish, often smelly vaginal discharge, frequent urination, rectal discomfort, and itching or burning in the vulva, vagina, cervix, and urethra where the bacteria thrive. If not treated, the infection can spread, causing skin rashes, swelling in joints and in the tendons of the hands and feet, meningitis and endocarditis, inflammation of the inner lining of the heart. Infection in the fallopian tubes can cause scarring and later infertility. Inflammation may follow. Babies born to mothers with gonorrhea may be blinded by the infection. Oh, babies born to mothers with gonorrhea may be blinded by the infection. Gonorrhea needs to be treated with antibiotics. The disease often goes hand in hand with other sexually transmitted infection, which should be identified and treated at the same time. Sexual partners must also receive treatment. There will need to be a cessation in sexual intercourse until after the treatment is complete. Syphilis, syphilis, syphilis. Mukhang tama ba pagkaano? Syphilis. Syphilis is one again on the rise. It is only passed between adults by a direct sexual contact with an infected partner, but an infected pregnant woman can pass the disease on to her unborn baby. So yun talaga yung ano yun, no? Pinaka-importante, healthy yung mother during sa pregnancy. Kahit bago pa lang bago hindi pa siya nagbuntis, dapat healthy siya para wala siyang ma-transfer na mga diseases sa anak niya. The first sign of infection shows within 90 days, but usually in about 20 to 30 days. It appears as a sore known as a chancre. Chancre. On the site of the infection, which may be on the lips or nipples, as well as in or around the vagina or anus. The sore is not painful and may heal spontaneously within a month or so. The lymph nodes in the groin may also become enlarged, but again, not painful. A danger with syphilis is that if the chancre is deep inside the vagina or on the cervix, it may come and go undetected. If there are any doubts in the wake of sexual encounter, it is essential to be checked. Blood tests will be done every 6 weeks or so until a positive result is seen. At this stage, it is called primary syphilis and is cured with a complete course of antibiotics that will kill off the infectious organism. Treponema pallidum. Treponema pallidum. If not stopped in this primary stage, syphilis develops into its secondary form, spread via the bloodstream all over the body. There may be fever, swelling of the lymph nodes, and distinctively a skin rash across the torso or palms and soles that doesn't disappear for weeks. There could be a patchy alopecia on the scalp. Alopecia. Alopecia. Hepatitis and kidney infection. Left untreated, syphilis will pass into its tertiary phase after years of apparent dormancy. It can act on the central nervous system, causing any number of terrible symptoms. This final phase, less common now thanks to the earlier and more successful treatment, was often called GPI, or general paralysis of the insane. HIV and AIDS. Unlike gonorrhea, which have been around for millennia, HIV human immunodeficiency virus is a mutated retrovirus that has been at threat for only around 30 years. The virus thrives in the T lymphocytes, the white blood cells responsible for immune responses. Normally, these lymphocytes destroy invading bacteria and viruses and develop antibodies to combat further attacks. When this defense system fails to work properly, invading cells can be destroyed nor antibodies develop. As a result, opportunistic infection are a constant danger. How the virus develops. If you are HIV positive, diagnosed by a blood test, your weakened immune system leaves you in a danger of developing AIDS, acquired immune deficiency syndrome. The usual progression, often after many years without apparent symptoms, is to develop a chronic fever and fatigue with swollen glands, diarrhea, and loss of weight. This is not AIDS but described as AIDS related complex or ARC. For some, this is a precursor to full blown AIDS, but others recover, not ridding themselves of the virus but not succumbing to AIDS either. Without an effective immune system, the body is defenseless and subject to one disease after another. Kaposi's sarcoma is a particular form of tumor associated with AIDS. Kaposi, kapo, kaposis, sarcoma. Kaposis sarcoma is a particular form of tumor associated with AIDS, often often seen as a bluish black lump occurring on the skin or other organs. Meningitis, blindness, and dementia are not uncommon. The risk. The virus travels from person to person via bodily fluid, predominantly semen or vaginal secretion and blood, although it is present in breast milk, saliva, urine, and excreta. Contact needs to be direct, which is why the most usual way of contracting HIV are unprotected sex, contaminated needles, or a baby from its mother. Stringent precautions are taken with blood for transfusion in all medical procedures, but risk from these sources exists in some parts of the world. Normal social contact does not spread the virus, and health workers do not catch it from patients. It cannot penetrate unbroken skin or lie in wait on toilet seats. Ay, morning. With no cure yet available, avoidance is paramount. The precautions against STIs outlined on page 138 apply particularly to HIV because of the long period when a carrier is infectious but has no symptoms. A strong person with a previously healthy immune system can bear the virus with little effects for many years, but could pass it on to others for whom it is an early death knell. Treatments. Individual infection can be treated according to their nature. Kaposi sarcoma by surgery or radiotherapy, pneumonia with long-term antibiotics, and so on. And there are expensive drugs available that aim to bolster up a failing immune system, but nothing has yet been found that actually kills the virus. What is recognized to make a big difference is a two-pronged approach to support your weakened immune system. Iyong gyapon na. Ay, napalod. Ganina po dire. Ulo po, pero murag nag-ayop sa'yo din. Wala na ako na-open. Ako pala napalod. Ikaw pa lang. Four. Sige, Jay. Salamat. Ah? Hmm? Palod po ka? Ha? 200? 09? Ha? Sir, 9.
100. 20 natin.
Oo. 0998-2318-495. 200 siya.
Kadugangan lang ko na kung kuhan.
Unsa?
Kung masigo.
Ha?
Kung masigo. Dugangan lang na kung binta. Minto na parang hindi. Dugangan lang kung binta.
Same gapon na number?
Oh. Hello, dago 100 eh.
Oh, naload na.
Binta na lang.
Ikaw sulat be.
Hello, dago tayo.
Oh, naload na. Ara.
Ah, tidak ba? Sa pagka.
Mm. Mm. Wait lang ha, mayroon nagpapaload eh. Sorry, 91562492523. One, two, three. Plus 091562492523. Done. Sorry. Treatments. Individual infection can be treated according to their nature. Kaposi sarcoma by surgery or radiotherapy, pneumonia with long-term antibiotics, and so on. And there are expensive drugs available that aim to bolster up a failing immune system, but nothing has yet been found that actually kills the virus. What is recognized to make a big difference is a two-pronged approach to support your weakened immune system. Living as healthy a lifestyle as possible and shielding your body as far as possible from infection. Hygiene. With this disease, the very backbone of the immune system is broken down. Instead of strengthening your body's ability to combat infection, every exposure weakens it further. So it is vital to protect yourself against minor infections that a healthy immune system will shrug off without difficulty. Cuts and scrapes, dirt from everyday life, the common cold will all have a debilitating effect. Avoid exposing yourself to others' ailments. Friends will understand that they should not visit you when they are feeling under the weather. You may need to find an alternative. For instance, to traveling on crowded public transport where not only coughs and colds circulate freely, but serious diseases such as TB are becoming a major worry in some cities. Wearing a mask will help shield you from inhaling airborne germs. Scrupulous cleanliness will help prevent infections reaching your body. This ranges from washing your hands before and after every activity to keeping your home hygienic and dirt free. All bodily orifices and crevices are potential entry points for infection. Bath at least once a day and be scrupulous about washing every part of your body, especially your genital, between your toes and your navel. Wet wipes are a useful standby, as well as cleaning your teeth and gums. Flush, floss, and gargle with a weakened solution of potassium permanganate. See personal hygiene for maintaining gum health. A daily nasal douche. Stir and dissolve 2 to 3 teaspoon of two-third. Sold and dissolve. Stir and dissolve two-third teaspoon of table salt into a 250 ml tumbler of lukewarm water. Pour some onto your palms and suck it into your nostril, or you use a nose dropper. Alternatively, if you can find an Indian inhaler known as Jai Jal Jalniti Jalniti Indian inhaler or niti pot, you could use this to inhale the saline solution. Splash your eyes with cold water 2 or 3 times a day and gently remove any accumulations in the corners of your eyes, especially when you wake up. Once a week, pour a drop of organic olive oil or pure mustard or mullein oil available from homeopathic shops into each ear at bedtime to soften accumulated wax so that it can be gently removed. Mm. Keep your nails short. So, hindi siya advisable yung mga pataas-taas ng ano. Blow your nose several times a day even if it feels clean. Mucus is an ideal nutrient for bacteria. In health, the ideal would be to move to a mountain retreat, a sanctuary where the air is pure and you can be as close to nature as possible. To eat only organic food and follow a regime of light exercise, rest, and meditation. For most people, this is not a realistic move, but it is necessary to treat both your body and mind as well as possible to maintain optimum energy and well being. So, pinaka ano talaga yung malinis ang environment, saka yung walang stress.
Bile.
Ha?
May essence po kayo?
Ano?
SS?
Wala.
Saan po makabila na?
Baka sa palengke. So, as much as possible, kailangan talaga healthy. Healthy, healthy. Eh, kahit ihabit yung ano, yung 1.5 liters of water a day. Yun yung isa din sa dapat mahabit. Or 2, 2 liters of water a day. Pero dito sa libro nakaano is 1.5 eh. So kahit yun yung habit, malaking ano na yun sa ano, malaking impact na yun sa health, sa body, para ma-boost yung immune system. So, that's all. Salamat sa makikinig. Then, God bless. Happy Saturday again. Bye-bye.